There is now consistent evidence that Omicron is spreading significantly faster than the Delta variant. And it's more likely that people who have been vaccinated or have recovered from COVID-19 could be infected or reinfected. Syria, Yemen, and elsewhere, WHO is delivering humanitarian aid, supporting health systems.
I think that what we need is better data. We need more studies from more countries looking at vaccines beyond mRNA and AstraZeneca. Those seem to be the only vaccines for which we have some data from clinical studies. And we should be able to update in a couple of weeks. But it does take a little bit of time to collect the clinical effectiveness data. So we need to be a bit patient, and it would be very dangerous to jump to the conclusion that the vaccines are not working.
Pandemic, and to beginning a new era in global health.
If you have a huge number of infections and even a very small proportion of them are going to be sick, you'll still have enough sick people to fill up hospitals and to overburden the healthcare system. So for this reason, it is probably unwise to sit back and think this is a mild variant. It's not going to cause severe disease, because I think with the numbers going up, all health systems are going to be under strain, and they already are in many countries.
Enrollments for courses on COVID-19 and many other health topics.
Of course, it takes time. Origin study, you know about MERS and the first SARS. This also may take time, but we need to continue until we know the origins. We need to push harder because we should learn from what happened this time in order to get better in the future. And I hope some of the challenges we have faced with regard to the origin study, especially in sharing information sharing data from China's side, will improve, because it will help. Without transparency and sharing of data, I don't think the origins could reach a successful conclusion. So we're hoping that this time they will cooperate better.
The largest number in over a decade, increasing risks from preventable diseases like measles and polio.
We do need to make progress there, and we would rather make faster progress than we're necessarily making at the moment. But we will continue as a secretariat to create the platforms and create and maintain the dialogue that's needed in order for us to better understand the origins of this disease, because mark my words, it will be important to understand, if we can, the origin of SARS-CoV-2.
Yes, thank you. So concerning the Sputnik V, the timelines are as follows. So the process was restarted, and we have now 2 deadlines for submission of documents. So part of the package will be submitted by 30th of December, and the final part of the package will be submitted by the end of January. So we hope that the applicant will conclude the submission of the application by the end of January.
That is the way to go. Everyone should get boosters. Are you not afraid to